2, 1.
Greetings. My name is Dr. Jack Einhaber, PhD. The purpose of this video is to introduce a plan for a universally acceptable solution to many of the major deficiencies in United States and worldwide health care. The proposed program would provide higher quality medical care through substantially reduced medical errors and improved prevention. Also, increased efficiency and lower healthcare costs via quicker, more accurate medical visits and accurate selection of necessary medical testing, while at the same time eliminating much of today's unnecessary medical testing. Now, the increased efficiency and cost savings will make such quality care available to many more persons. There's also potential to catapult our medical knowledge and match patients who have complex illnesses with physicians who are esoteric or very knowledgeable, who have a special knowledge in those complex illnesses. It's a non-political, simple, and sensible scientific system, and it's readily understandable to non-medical or lay people. It's compatible with any healthcare system, including both the previous U.S. healthcare system and the current Patient Protection and Affordable Healthcare Act, also known as Obamacare. Now, it's time to provide common ground between United States Republicans and Democrats in order to prevent differing approaches to healthcare from causing future government gridlock. Now, I'm going to explain the fundamental aspects of the system using a diagram, but I urge all of you to listen to a discussion that follows so that you can truly understand the implications of the proposed program. Before showing you the diagram, I'll just say that the pivotal point of this system is an incentivized, and this will be explained in detail, culturally oriented pre-doctor visit symptom questionnaire, which is cross-referenced with the patient's medical history and pharmaceutical profile. It's then analyzed by a valid computer program. So, when the patient enters the doctor's office or exam room, the physician already has the recommended potential diagnoses, tests, and treatments, complements of the computer. Now, to avoid an overly lengthy video presentation, this program proposal will be presented as 4 separate videos. Okay, so here's the first one, and this gives you the overall strategy. Now, it starts off with symptoms. Either symptoms that arise spontaneously or symptoms that a patient thinks of when they have their annual or periodic physical. So now those symptoms are put into a culturally oriented questionnaire. Now, there's going to be incentive for the patient to fill this out. And there'll be modifications for patients who have trouble reading, who are more comfortable with doing a video or an audio type of response. And the incentives will be proportional to the amount of time and money that the questionnaire will save the system. And this will be calculated based on a pilot or a representative initial study to see how well the system works. Okay, so the questionnaire is filled out, and there's going to be support through a support staff and a helpline to help people fill this out. Now, the questionnaire will then be filtered through a computerized database of our existing medical diagnostic knowledge. And it will be cross-referenced with the patient's individual medical records and interfaced with the patient's pharmaceutical profile. Now, the result will be transmitted to the doctor's office prior to the visit, so that the physician has this at hand when the patient walks in. And hopefully the physician will have studied this prior to the time the patient walks in. Now, this can be done in several different ways. The input can be directly put in via computer, and this would of course have to be, well, the whole system will have to be a secured system of information transmission in order to protect patients' privacy and their rights. So it can be done directly into the computer and being able to be downloaded by the physician's office. Or there's several other ways that it can be done. One would be to be filled out like the mass testing questionnaires with multiple choice, and if there are any notes or whatnot that don't fit into the categories, those can also be transmitted into the system. In any case, when the patient arrives in the doctor's office, the doctor already has the results of this system. And so what will happen is there will be reduced visit time. And the reason for that is because the doctor will have a lot of advanced information. Now, the reduced visit time will also occur because this system will save the doctor a lot of probing. The doctor won't have to ask as many questions because the questions have already been asked in the questionnaire. So, that time will be reduced. And the time of reduction will be used to calculate or partially calculate the savings to the system. And so that patients who fill out the questionnaire will get a proportional discount, or conversely, they may pay a proportional penalty for not filling out the questionnaire in advance. Now, because the computer is not subject to the same kind of errors that human beings are, there will be a reduction in medical errors. In 1999, the Institute of Medicine, which is a division of the National Academy of Sciences, estimated that between 44,000 and 98,000 people lose their lives annually due to medical error, and that a lot of these errors are preventable. And this system will help prevent these. And we'll go into more detail on that in the subsequent videos. Now, there will also be a proportional, or well, we don't know if it'll be proportional, but there will be an accordant reduction in medical malpractice litigation. Because if you don't have that many errors, there'll be fewer medical mishaps. And consequently, there should be less malpractice litigation, because there will be fewer adverse events. Okay, now I'm going to slide over to the other side here, hopefully without knocking anything down. All right. So the system here will act as an advanced second opinion, and therefore it should be supported by all who want higher quality health care. Insurance companies will also benefit from this because of fewer medical malpractice lawsuits, less wasted money and effort in terms of unnecessary medical testing, and the increased efficiency that this system will bring. Other aspects of the insurance industry, those that provide physicians with malpractice insurance, will also benefit because there are going to be fewer lawsuits. And doctors will be less fearful of not over-prescribing tests because they will have the luxury of a second opinion from an objective source. The computer is objective, unlike human beings. Now, of course, we'll have to make sure that the programming and the input into the computer is valid, because what the computer comes out with is only as good as the program and the human effort that's behind it. Again, we'll get into that in the other videos. Okay, so the result will be that more people will have high quality, safer health care at an affordable cost, more of an affordable cost. Okay, so the system is more prevention oriented, and this is of course important too. The old saying, an ounce of prevention is worth a pound of cure, really applies to medicine. Okay, so the increased efficiency will come about due to more accurate test selection, the fewer unneeded medical tests, the quicker and more efficient medical visits, and we have some bonus aspects to this system. There will be an opportunity to enhance our medical knowledge and database, because it can be programmed in such a way that the patient's input can be analyzed on a mass level and increase our knowledge of our medical conditions and what works, how to diagnose them, etc. Okay, now there's another very potentially important opportunity here, and that's to match patients with unusual conditions, patients who suffer from complex medical illnesses that are not that readily understandable or available to most physicians. Will be able to be matched with specialists who are esoteric or knowledgeable in those conditions. All right? Now, let me head on back here. In the future videos, we'll give much more detail about this overall strategy. So, the second and the third videos will provide a rationale or reasoning behind the strategy. There'll be a discussion of aspects of medical errors, different references or sources to help understand some of what is really going on today behind the scenes in medicine. And a lot of you are going to find this shocking, enlightening but shocking, because most people don't really understand what goes on here. Now, there's also going to be details of the plan for implementation. In other words, how to make this work in the real world. Now the fourth video, so that's the second and third videos. The fourth video is going to be a dramatization of how the system works. And my very beautiful staff, and I know you're going to agree with me, are going to be the ones who present that. And by that time you should be tired of looking at my face, and you'll see some very, very fresh, pretty faces. All right, now the ideas presented here come from my own education and hard-learned experience. I've spent about 1.5 years of my life in numerous hospitals in various cities, in various states, Canadian provinces, and countries. I've had over 100 surgeries, and I was told 6 times that I would die in anywhere from 5 years to within a few weeks. And I was actually dead on the table during a liver transplant for a very rare, non-communicable orphan illness. Therefore, out of desperation and out of hard-learned experience, I gained rare insights about the positive and negative aspects of healthcare not normally available to most lay persons. I was also very fortunate to get an excellent education at one of the foremost universities in the world. And at the time I went there, it was the top-rated overall university in the United States. Harvard at the time was second. Now, I owe my life many times over to the many fine physicians who went above and beyond to save me, above and beyond the call of duty. But I'm also plagued with severe injuries and disabilities, at least one of which is life-threatening, from those who made mistakes, or were simply not amply diligent or shirked their duties, or simply lacked a genuine concern for patients. But make no mistake about it, even the finest physicians, the finest, most brilliant, creative physicians make mistakes. And, this is just simply unavoidable in the human condition. I also owe an indescribably huge debt to the family of my organ donor, an unfortunate 21-year-old young man who was shot through the head in Brooklyn, New York, January 31st, 1999. There's not enough I can say about this except that if this program is successful, and it should be, part of the credit will go to those people in that family that gave the okay for me to stay alive, because it looked like I wasn't going to make it. Now, my proposed solution emphasizes technological applications rather than administrative, philosophical, or political considerations. Once the system is established, those aspects should fall into place pretty much naturally. And complications of healthcare delivery and practice should be greatly reduced. Now, this program strives for objectivity over subjectivity. It's also designed to counter one of the most frequent criticisms of the Affordable Health Care Act, and that is that quality is sacrificed for quantity. United States and worldwide medicine operate under an inefficient delivery system. The actual practice of medicine is many years behind the medical technology. Medical technology is science, whereas the practice of medicine, as it's currently being performed, is more of an art. One might think of the medical system as a car. Now, this car is propelled on its wheels, right? Now, let's take some examples of what these wheels might represent. And we're talking about mostly unsung heroes of medicine, technological heroes in a lot of cases. Now, these include, but are not limited to, let's say, wheel number one, the chemists who develop and compose the pharmaceutical medicines or drugs. Wheel number two, the physicists who conceive of and design marvelous diagnostic machines available to us, such as CAT scanners, MRIs, and even standard X-rays, which were once considered a miracle, which now many people take for granted. Wheel number three might be the engineers who build these tremendous technological marvels. And wheel number four might be the computer programmers who are helping to automate a partially outdated system, much of which is out of control in the sense that there exists a lack of standardization and consistency. And there are many other important groups that function behind the scenes. Those are just examples. The physician or the doctor's job is to apply, manage, and administer the various tools and personnel for the benefit of the patient, and to use the doctor's training and knowledge to benefit the patient, to come up with diagnostics and cures, therapies. Now, continuing our car and driver analogy, the doctor would be operating the fifth wheel, which is probably the most important wheel of all, the steering wheel. But inside the car, there are many distractions. Consequently, the doctor, many doctors often don't take the time to keep up with new developments in research. Others are not sufficiently educated or knowledgeable to understand the new developments in the field. And some doctors aren't in medicine for the right reason. They really don't have a genuine concern for patients. Then there's staff issues and problems normal to any working situation. You know the kind of thing I'm talking about. Inconsiderate, rude people, petty annoyances, conflicts, jealousies, misunderstandings, etc., etc., etc. Then there's problems or demands peculiar to medicine, such as constant issues with insurance companies, paying bills, collecting payments from both insurers and patients, dealing with hospital administrators, oversight committees, oversight personnel, compliance with rules, regulations, policies, procedures, learning practices, etc. And a doctor might need to deal with the ego of fellow physicians, rebound from a negative phone call or other interaction with a family member or a significant other, and dealing with unwanted attraction dynamics from fellow staff members or office employees, etc. That's not even to mention distractions from the physical condition that humans endure, such as headaches, toothaches, stubbing one's toe, stomach aches, you name it. All right. So the computer doesn't have toes to be stepped on. The computer doesn't become insulted. The computer doesn't fall in love with the computer next door. So the computer doesn't have to worry about paying bills. Now, we'll get into more detail on all this, and some of this is going to be very fascinating, I think you'll find. Matter of fact, I'm confident you'll find that. Now, I want to give a shout out to the United States military, without which none of this would be possible. The United States and its coordinating militaries from other countries, allies, are the reason that we're able to have a lot of the freedoms and leeway that we have right now, to have this wonderful system, to have this wonderful debate. So I just wanted to pay homage, because what the people that sacrifice for the United States military, the soldiers, the support personnel, they sacrifice for us is just, it's beyond words. It's beyond words to describe this. Now, that's not to say that everything in the United States, which is a great and wonderful country, is peachy poo or is as it should be. And I'm working, and I'm almost finished with my book on increasing government efficiency, reducing government corruption, and fostering improvements in many aspects of our society, including education, and especially trying to enhance our educational delivery system in terms of science, mathematics, logic, and intercultural understanding. Now, in terms of other change, I'm a veteran police officer, or I was a veteran police officer, and I believe in constructive and peaceful ways of change. So anyway, with that, I want to thank you very much, and thank the staff here that functions behind the scenes, makes this possible, and invite you to view our subsequent videos. I think you're going to really benefit from them and enjoy them. Thank you very much.